CBT Unit 4. Part B. Therapeutic strategies. Specific, targeted cognitive and behavioral interventions. Psychoeducation. Thought challenging. Graded exposure. Behavioral experiments. Between session work. Useful questions in assessment. What would you like to work on? How would you like to use today's session? What are you doing that you would like to change? What are the triggers, situational, mental or internal, for the problem behavior, and in what settings does the problem occur? What are the consequences of the problem in the short term or long term? What changes might be made in any of these to produce changes in the problem experience or behavior? Can you give me a recent vivid example of when this issue arose? Self-monitoring. Use of diaries can in itself be therapeutic. Useful to collect evidence about how much of a problem the problem is. Use clearly defined tasks. CBT requires that the client do a lot of homework, and keeping a diary of thoughts, feelings and behavior is a vital part of the process. Make record keeping easy. Simple to complete. Allows entries to be made as soon as possible after an event. Consider what types of information you feel are important to understanding the problem. Frequency. Duration. Self-ratings. Basic CBT diary sample. Consult the study material for more detailed examples of the diary. Activity diary. Mastery and pleasure record. Self-report questionnaires. Formal assessment examples. Beck Depression Inventory. Beck Anxiety Inventory. Outcome questionnaire. Global rating scales. Observation of naturally occurring behaviors. Role play. Useful if problem is associated with interpersonal interactions. Can be easily repeated pre- and post-treatment to assess change. Be cautious, however, performance in role play is not necessarily associated with performance in everyday settings. Behavioral tests. Avoidance tests do something that has been avoided and rate the distress associated with doing the normally avoided act. Measures obtained can be specific, objective measures. Include ratings by client and therapist. Intervention strategies should always be based on a sound formulation, relevant to the client's goals, negotiated with the client, clearly explained, used both in and between sessions. Main intervention options. Cognitive, for instance, thought review, diary keeping, research. Behavioral, for instance, behavioral experiments, exposure, role play. Behavioral interventions. Behavioral activation, exposure, behavioral experiments, tests of the client's hypotheses. Feel the fear and do it anyway. Acting as if. Sometimes the fear will not go away, so you will have to do it afraid. Exposure therapy. Exposure to feared or previously avoided situations is one of the most widely used psychological interventions. The evidence for its efficacy is very good, and it encourages the client to widen their behavioral repertoire by making moves in the direction of their chosen values. Traditionally uses habituation as its rationale. Exposure. How does it work? It works through a process of habituation. This is the natural reduction in arousal which occurs if a person remains in the presence of the threatening stimuli for a long period of time. As a result, the person unlearns the association between the threat or fear and the stimuli. The brain experiences and learns that the feared object or situation is not in fact dangerous. What makes exposure effective? Grading the exposure. Best results are achieved if the threatening stimuli is confronted gradually. This means starting with situations that cause the least amount of anxiety or fear and moving up a hierarchy of situations. Not escaping from the situation. Non-avoidance of situations at that level of the hierarchy. At each step of exposure, the brain will have an opportunity to reassess the level of threat. The amount of practice and repetition needed for lasting habituation is often underestimated. A client with panic disorder or a phobia will usually need to spend hours, not minutes, in a threatening situation. Anxiety should drop by 50% before the client stops or moves forward in the hierarchy. Therefore, sessions also need to be longer. End of Part B. Please proceed to Part C.